Good morning from the Indiana State House. We spend a lot of time in this building behind me during the legislative session, but today I'm going to be over in the Government Center South. Team Institute spends a lot of time in the State House, but especially when it's not in session, there are a lot of activities happening in the Government Center. So on our right, we have the Government Center South and North, and on our left we have the State House. And so today I'm actually going to see FSSA's presentation of their quarterly financial report. So this is something that's going to give us information on a variety of programs. So I'm really curious to hear from the program administrators, from the secretary himself, and just to get a sense of where things are at, especially with Medicaid. Now, one thing to note, if you're not familiar with the Government Center campus, there are limited public entrances, so you want to make sure that you find one that has public entrance so that you can actually go through the security. Otherwise, the doors will be locked. So it's pretty quick and easy to get through security, and then it's a matter of finding where you need to go. So there are directories, and there are also people you can ask for help. But if you're in the Government Center for an event, there's a pretty good chance that your room information is posted on a board somewhere. So here I can see we need to head to the auditorium, and we're going to hear from a lot of different groups today. So Division of Family Resources, Office of Early Childhood and Out-of-School Learning, Division of Aging, Division of Disability and Rehabilitative Services, Division of Mental Health and Addiction, and then finally the two I'm most interested in, the Office of Medicaid Policy and Planning, and hearing directly from the Secretary about his plans for the agency moving forward. Got registered and checked in. It's time to head into the auditorium and find a seat. Alright, we've made it into the auditorium for the presentation, so let's see what we have in store today.
Here is an overview outline of the things we're going to cover today for the Division of Family Resources. DFR is also responsible for the timely and accurate determination for Indiana's Medicaid programs such as HIP. These are our SNP program metrics. So for SFY 25, on average, we serve 600,295 recipients every quarter, and the average number of households per year was 286,449.
Very important to get outside and get a little sunshine during the breaks between all of the sessions. So far this morning we've seen a lot of changes from previous fiscal years when we're looking at these finances, some historical trends that are maybe changing. So very interesting to learn and see what all is going on at FSSA and the many programs that they administer. For all the Aaron Sorkin fans, and for folks who just need a snack, thankfully right outside the auditorium under that West Wing sign, there's this old convenience shop. So I grabbed myself a coffee and headed back in to listen to the next session.
I said we have a new entity with a familiar name, so we're very excited about the possibilities that this has to offer. We have put together a new structure that we will be effectuating and implementing over the next several months.
As always, we want to cause no harm, so whatever action we take, we want to ensure that we have sustainability so as to not negatively impact the Hoosiers that we're supporting.
We're breaking for lunch, so gonna go grab a snack, do some emails, and get back for the afternoon. All right, lunch break's over and it's getting hot outside, so I had to put my hair up, but we're heading back in. I'm really interested to hear about the updates from the Office of Medicaid Policy and Planning, given all the federal things going on. We're also going to hear from the Division of Mental Health and Addiction Services this afternoon, and then it's going to close out with a presentation directly from the FSSA Secretary. So lots more to come. Let's see what we can learn this afternoon. Next up are the Medicaid updates, so we're going to be hearing a lot about enrollment in the program, expenditures, and how they plan to curb costs moving forward.
So for the year, we covered 1 out of 5 Hoosiers. I think one of our questions is, are the healthy Indiana Hoosiers as healthy as the other 4 out of 5? And that's something we'd like to better understand. In a few months, we're actually seeing some declines in our Hoosier Health-Wise in our HIP program. And even in July, which is not part of this fiscal year, July, we're continuing to see declines. And those have to do with determination changes. And one of the things we're not sure about is if some of these people will drop off and come back on the program, but this is something we're going to have to include in our forecasting and our pricing for the future, what we think about those continued declines in those two particular programs.
The day with us. We really appreciate it, and I hope that it gives you a better sense of where we've been. The next 30 minutes or so, I hope to give you a sense of where we're going. So, we are all on the FSSA. This morning in the DFR presentation, the state of Indiana needs to find approximately $36 million more in state general revenue fund to allow us to fund SNAP. We obviously are not going to get rid of SNAP. SNAP is too vital a component for those who are food insecure in Indiana. Adam did a really good job of discussing the issues that surround child care in the state of Indiana. We remain determined to keep the same amount to make sure if you have a voucher today, that you continue to have a voucher tomorrow. That is no small task for Adam to do. Unfortunately, as I think we articulated this morning, what that means is we are not adding any additional children who are in need of child care. We simply do not have the funds to do that, and that is a shame. How much is Hoosier Care Connect going to cost? $1.5 billion. How much is Pathways going to cost? How much is fee-for-service non-LTSS going to cost? How much is Medicaid buy-in going to claw back? How much? What's all that stuff going to cost? And in 2023, that added up to $17 billion. And then it went and said, okay, how much can we get? How much can we get from federal funds? How much can we get from IGTs? How much can we get from provider tax receipts? How much can we get from half funding? That is not how we're going to build the 28-29 budget. We're going to build the 28-29 budget much differently. 2%, because that's what the general revenue fund's going to grow at. Because that's all we can afford. To some degree, well, I mean, right now I've got three tools. Right now we have three tools, right? We can decrease eligibility, we can decrease provider reimbursement, or we can decrease the amount of care each individual gets for a specific period of time, right? We're hoping that we can use some AI magic to find different ways to do this. That has been effective in other industries. I've yet to see it be effective in healthcare, but we will try.
At the end of the day, these financial statements, they can seem a little dry, they can seem pretty boring, and honestly difficult to comprehend. But what those dollars really translate to are services for people that we care about, whether that's aging in place gracefully, staying in your home, making sure that your kids have safe, quality childcare. One piece that I was a little disappointed to see today was this framing of state revenue as a zero-sum game. That if we're spending $1 for a person who needs healthcare, that's $1 that we're taking from a child who needs education. And ultimately, budgets are not zero-sum games. When governments need to fund services, they implement taxes, they raise revenues, and those help folks in the community. So, no matter how you look at it, these dollars matter. We know when Hoosier families are financially stable, they're happier, they're healthier, and they thrive. So let's make sure our policies are focused on supporting the most vulnerable members of our community. All right, well, that's it for the Government Center. Thanks for spending the day with me, and stay tuned for more updates.